Hello everyone, today we'll see the important topics for the history station, and today we'll see the topics for GIT and endocrine system. So the scenario for the history station could be either of the acute history can be asked, or chronic history, or acute on chronic history. So it can be either one of these. If it is an acute history, you need to focus more on history of present illness, and if it is a chronic history, you need to focus more on the past history. And if it is acute and chronic, focus more on the history of present illness and on the past history. This chronic and acute and chronic will definitely take a detailed history, so time management is very important for this histories. Okay, and let's see the topics for the GIT system first. So the important topics for the system are: the history can be related to the abdominal pain. Non-specific abdominal pain, you need to ask all the questions to rule out the organic cause, or it can be functional abdominal pain, or it can be related to the acute area or chronic area. Constipation, vomitings can also be asked in the history station. Sometimes Sandifer syndrome can be kept as a history. Sandifer syndrome, it can be related to the gastroesophageal reflux disease, preterm baby with the gastroesophageal reflux disease, or jaundice. Neonatal jaundice has been asked in one of the centers. Autoimmune hepatitis, or food allergies or intolerance. It can be either related to the common protein allergies or multiple food allergies. Celiac disease, very commonly asked in exams. Celiac disease or inflammatory bowel disease. It can be either Crohn's disease, mostly it will be Crohn's. Sometimes ulcerative colitis can also be asked. Bleeding per rectum or hematemesis, that is portal hypertension. Next is biliary atresia, liver failure or transplant. Sometimes failure to thrive with the gastrostomy tube can be asked. Or any other like syndromes with GIT disorders can be kept in the exam. Okay. So let's see. So abdominal pain, functional abdominal pain, acute area, chronic area, constipation, vomitings, gastroesophageal reflux disease with the preterm baby, jaundice, neonatal jaundice, autoimmune hepatitis, food allergies, intolerance, common protein allergies or multiple food allergies, celiac disease, inflammatory bowel disease, portal hypertension, biliary atresia, liver failure, or transplant failure to thrive, or any syndromes can be kept, like the Wilson's disease. Wilson's disease can also be kept. Okay, alright. Next, we'll see the important topics for the endocrine system. So in the endocrine system, the important topics are type 1 diabetes with or without TKA, type 2 diabetes mellitus, especially with obesity, or MODY can also be kept, maturity onset diabetes of the young. Hypoglycemia, very important. Hypoglycemia. Hypothyroidism. Hyperthyroidism. Next is Addison's disease. Addison's disease is represented with weight loss or increased skin pigmentation. Next is Cushing's. Cushing's disease, diabetes insipidus, delayed puberty, very important, delayed puberty or precocious puberty, short stature, very rarely tall stature associated with some syndrome, Klinefelter's or Soto's cancers. Next is obesity, vitamin D deficiency, hypocalcemia, congenital adrenal hyperplasia, very important, pseudohypoparathyroidism, pseudohypoparathyroidism, next is any syndromes, especially Down syndrome with a hypothyroidism can be asked. So type 1 diabetes with PK, type 2 diabetes or maturity onset diabetes of the young, hypoglycemia, hypothyroidism, hyperthyroidism, Addison's disease, Cushing's, diabetes insipidus, delayed puberty, precocious puberty, short stature, tall stature, obesity, vitamin D deficiency, hypocalcemia, congenital adrenal hyperplasias or pseudohypoparathyroidism, and any syndromes. Okay, so these are the very important topics, so please practice these topics before you go for the exam, and that's all for the session today, and thank you so much and take care.